Hi, here we are today, part of the Smart Golf Coach team at beautiful TPC Sawgrass in Ponte Vedra Beach, Florida. We're here to offer you a physical assessment tool specific to golf by experts in physical therapy and rehab, Chris Kopp and Eric Mason from Premier Physical Therapy here in Jacksonville. What Chris and Eric are going to do today is go head to toe with you to identify any physical weaknesses or limitations that may be prohibiting you from optimizing your golf performance.
The first test in our screening tool is the eye dominance test. This helps you to determine which of your eyes is dominant so that you and your golf pro can work on head positioning and targeting issues. Hold a finger out in front of the face, arm's length away, and align it up with something about 10 feet away. Close or cover the left eye and see if the open right eye keeps the finger in alignment with the object. Then close or cover the right eye and see if the open left eye keeps the finger in alignment with the object. The object will shift out of alignment while covering one of the eyes. The eye that the distant object does not shift position with is the dominant eye. The next test in our screening tool is the DIP flexion test. This targets finger flexibility and hand symmetry. The procedure is to open the hand and straighten the fingers, bending the last two knuckles of all the fingers while keeping the first main knuckle straight. You want to look for asymmetries, deviations, or deformities, the inability to isolate the last two joints of the fingers, the inability to straighten the fingers fully, or the inability to bend the fingers fully. This test can uncover issues that may cause a golfer difficulty maintaining proper grip or abnormal grip positions and pressures. Another upper extremity test is the tabletop test, which targets the strength of the lumbrical muscles and the potential strength of the grip. The procedure is to open the hand and straighten the fingers and bend the first knuckles, keeping the fingers straight and together. You're looking for a 70 to 90 degree bend in the first knuckles, the ability to keep the fingers straight, and any asymmetries, deviations, or deformities. This test will uncover issues that can cause a weak grip, or compensations for poor grip strength or abnormal glove wear. Our next test is the forearm rotation test, which targets your ability to rotate the forearms in such a way as to bring the hands palm up or palm down. Keep your elbows at your side and bent to 90 degrees while turning the palms up and then down with an open hand. You want to look for range of motion limitations, the inability to isolate forearm rotation, or any compensations that may be occurring at the shoulder, elbow, or trunk. Problems turning the palms up or down can lead to a variety of swing faults, which will be listed here. Our final upper extremity test is the wrist cocking test, which targets wrist strength and flexibility. Hold the club at the bottom of the grip, thumb along the shaft, and keep the elbow straight along the trunk. Raise the toe of the club as high as possible. Repeat this test on both sides. If the shaft of the club does not reach parallel to the ground, you can repeat the test holding a little closer to the club head to determine if the limitation is a strength or a flexibility issue. You want to look for the inability to raise the club to parallel with the ground, or any compensations such as rotation of the club head, elbow bending or wrist compensations, or movements at the shoulder or trunk. This test will reveal issues that can lead to casting and chicken winging, decreased power and distance, or being off plane at the top of the backswing. The next test is the address position test. Here we're looking for postural asymmetries in the address position. We're looking for excessive rounding, which can lead to casting or over-the-top type swing deviations or a takeaway slide or sway. Or we're looking for excessive hyperextension, which can cause a reverse spine angle or a loss of the proper spine angle. Our next posture test is the neck rotation test, which targets rotational flexibility of the neck. In this test, we are turning the head as far as possible to the left, and then slowly turning it as far as possible to the right. We are looking for a chin position that ends up just past the point of the collar, and we're also looking for compensations such as head tilting, excessive shoulder or trunk movement, or a pain response. Problems with rotational flexibility in the neck can lead to decreased arm height at the top of the backswing, decreased shoulder turn, takeaway slide or sway, or a loss of spine angle. Our next test is the overhead club raise test, and this targets tightness in the pectoral and latissimus muscles. We want to stand in the address position, holding the club with the hands about shoulder width apart, and raise the club over the head. And we want to do this 1 or 2 times, looking for how far we can get the club over the head, maintaining straight elbows. We also want to repeat this test by bringing the hands close together on the club shaft and then raising the club overhead. And what we're looking for is the inability to raise the arms to perpendicular. If you have difficulty doing it when the hands are apart, that can mean that you have pectoral tightness. And if you have difficulty raising the arms when the hands are together, that can show latissimus tightness. You also want to look for loss of spine angle or proper address posture. You want to look for compensations at the trunk or head, and you want to look for loss of balance. Restrictions revealed by this test can lead to decreased arm height at the top of the backswing, faulty swing plane, deviations such as over the top, trapped elbow or flat takeaway, takeaway sway and slide, or restricted follow through. Our next shoulder test is the Apley position test, which targets flexibility of shoulder rotation. We want to reach behind the back with the left palm facing out and reach behind the neck with the right hand palm facing in, and attempt to touch the hands together behind the back. We want to look for the fingertips of the top hand to be below the tops of the shoulders and the fingertips of the bottom hand to be within 6 inches of the top hand. And we're looking for symmetry in both shoulders, so you want to repeat the test on both sides. Issues with shoulder rotation can lead to multiple swing faults, which are listed here. Our final shoulder test is the reach across test, which targets tightness in the posterior capsule of the shoulder joint and targets shoulder flexibility issues. You want to hold your arm out 90 degrees to the side with the elbow straight, bring the arm across the body with the palm down, and pause at the end range and apply a little overpressure. And what we are looking for is elevation of the shoulder into the chin. We want to see that the elbow is able to pass the chin before the shoulder raises. We also want to look for compensations in the elbow or shoulder. And we want to repeat the test on both sides. Problems revealed with this test can lead to lack of arm height, over the top swing faults, takeaway slide and sway, or loss of spine angle. In the trunk rotation test, we are targeting rotational flexibility of the trunk, mobility of the spine and hips, balance, and postural stability. We want to start in the address position, rotate as far as possible, and pause. And then we want to repeat in the other direction. And what we're looking for is the limited ability to rotate through the full range. We're looking for asymmetry between left and right rotation, any problems with reverse pivot or spine angle, and we're also looking for loss of balance. We're also looking for the tendency to go into too much extension in either direction. And we're also looking for a tendency to go into too much flexion during the rotational motion. Problems revealed in this test can lead to reverse pivot or spine angle, early extension, takeaway slide or sway, or other compensatory swing faults as listed here. The next test is the hip rotation test, which targets rotational flexibility of the hips. You want to lie flat on the back with the hip and knee bent to 90 degrees, and we're going to rotate the hip inward and outward, and then we're even going to apply a little bit of overpressure to see what type of rotational flexibility we have in both directions. We have to be very careful with this test if there is any known pathology in the hip or a total joint replacement of the hip. We want to repeat this test on both sides, and we're looking for 40 degrees of motion or more in each direction, and we're looking for symmetry between the directions and also between the two hips. We're also looking to see if there's any pain with that motion. Implications of this test are numerous and listed here. Our next lower extremity test is the sit and reach test, and this targets hamstring flexibility. You want to sit with the legs together, knees straight, toes back, hold the club in both hands parallel to the ground, and keep the back straight while reaching for the toes with the club. You want to hinge at the hips and avoid rounding the trunk forward. Excessive rounding of the trunk, asymmetry between the right and left legs, the inability to reach past the knees, or compensatory knee bending, or even signs of discomfort are things that you want to look for in this test. Issues with hamstring flexibility can lead to extension of the back knee on the backswing, poor address posture, loss of spine angle, or a tendency to injure the low back. Another lower extremity test is the full squat test, which targets lower extremity strength, flexibility, and balance. We have to be careful with this test if there is known pathology at the hips or knees, or if there's total joint replacements. You want to stand with the golf club out in front, hands shoulder width apart, and attempt a slow full squat. We're looking for issues such as excessive forward bending of the trunk, evidence of weakness in the hips or legs, issues such as the heels coming up off the ground, which could indicate tight calves or heel cords. We're also looking for loss of balance or other deviations or asymmetries. You also want to take a look from the front to see if you have problems with the knees coming together excessively or if there's any other instabilities while performing this movement. Issues with lower extremity strength and stability can lead to multiple swing faults, including reverse pivot or spine angle, loss of spine angle, takeaway slide and sway, and difficulty on uneven terrain. Our next test is the single leg bridging test, which tests for core strength and stability of the hip girdle. We want to start lying on the back with a club balanced across the pelvis. You want to bend the knees and lift the body up into the bridge position, raising the bottom up off the ground. We then want to lift one leg and straighten the knee, and we also want to repeat this on the opposite side. What we are trying to do is make sure that the club stays balanced, and we're looking for the pelvis dropping on one side, causing the club to dip. We're also looking for the inability to lift the leg without losing balance, and we're looking for any asymmetry between the left and right sides of the body. If there are issues with core strength and hip stability, that can result in poor address posture, loss of spine angle, loss of power and distance, and also a higher potential for low back injury. From the side view here, we're looking at a good symmetrical single leg bridge where the thighs are parallel, the club is balanced, and everything looks relatively symmetrical. Same thing on the right side, the right leg is parallel to the left at the thigh, and the club is balanced. Issues that might occur during this test are rotation at the hip, causing a little bit of a dipping of the club. Other issues could be difficulty getting the leg up to a level where it's parallel with the other thigh, or weakness at the hips, which causes excessive rotation of the pelvis, causing the club to drop off. Other issues that may be observed are weakness causing the inability to raise up into the bridge position, and the inability to get one of the legs off of the ground to go into the single leg bridging position. Our next test is the prone plank test, which tests for core strength and lumbar stability. We want to start in the prone position and then raise up on the toes and elbows, keeping the back perfectly straight. If we're able to do so, we then want to raise one leg at a time, picking the leg up off the ground, keeping the knee straight and attempting to hold for a few seconds, and then repeat on the other side. Weaknesses, asymmetries, or instabilities revealed during this test can result in poor address posture, loss of spine angle, over-the-top swing faults, or a tendency to injure the low back. Some of the things that we want to look for during this test are profound weakness that prevents you from being able to raise the trunk up off the ground and assume the prone plank position. Other issues may be weakness of the core or the hip girdle that prevents you from being able to raise the leg straight up off the ground, resulting in excessive knee bending. Other issues that may be observed are weakness causing hyperextension of the lumbar spine, the back sagging, or compensatory motions at the neck or upper trunk. Our next test is the unilateral stance test, which targets balance, proprioception, as well as ankle, hip, and knee stability. You want to start in the address position, stand on the back leg, and move into your backswing. Then you want to stand on the front leg and move into your follow-through position. We're looking for the inability to move slowly and smoothly, loss of balance, and loss of proper posture. Issues revealed in this test can lead to swing faults that are listed here. Final test in our screening tool is the unilateral stance test with eyes closed, which targets proprioception or body position awareness. We want to stand on one leg only, close our eyes, and maintain our balance. If we're able to maintain our balance, we then want to tilt the head back slowly to see if we can maintain the balance in that position. What we're looking for is the inability to hold for at least 20 seconds or excessive body motion. Issues with balance and proprioception can lead to poor body position awareness, poor consistency, difficulty on uneven terrain, and difficulty replicating what our golf pro is trying to teach us.